Good morning, everyone. As we enter in to the room, allow folks to get in. Happy St. Patrick's Day. Give a little time, a little more time as folks are coming in. Okay, I'm gonna let two more people. I see the numbers going up. I want to let two more people in. Okay. So good morning, everyone, and welcome. My name is James Soward, and I'm with San Bernardino County Superintendent of Schools, and I'm glad to be with all of you today. As you know, this is part of our Transforming Together webinar series focused on the ecosystem of care implementation guide. And today we're diving into chapter 2, which is developing shared goals and centering youth and families. In our first session, we grounded ourselves in shared leadership. And today we'll take the next steps, moving from shared leadership to shared outcomes, which is where the work really begins to take shape. What this chapter challenges us to think about is how we move beyond alignment in theory and really ask, how do we begin to use data? How are we engaging communities? And how are we coming together across systems to define what success actually looks like? And with many of our systems are already doing this, but often in isolation. And what the guide is helping us to do is move towards something more coordinated, where we have shared priorities, shared measurement, and shared responsibility for outcomes. You'll hear today about how data and community voice come together, not just to inform decisions, but to co-create outcomes with youth and families we serve. We also have a strong lineup of presenters, and I want to thank our presenters for their time and efforts and information that they have, and a county spotlight that will help bring this work to life in a practical way. So with that, thank you for being here and for the work you're doing to build stronger and more connected ecosystems of care. So we'll get started, and I'll pass it to Elizabeth.
Hi, everybody. Good morning. We can go to the next slide. So in this training, we're going to be talking about chapter 2 of a 4-part series, and these are the dates for the convenings. So hopefully all of you can join all of them. And we can move to the next slide. As housekeeping, all of the questions can be submitted at any time through the Q&A feature. And we're going to be monitoring the Q&A throughout the webinar, and we're going to be having time at the end to have a conversation about all of your questions with regard to furthering your work or with regard to anything that you've heard here from any of our presenters. And the links and the resources will be shared in the chat. And the chat is disabled, so please use the Q&A if you have questions, and we'll definitely work to get to them at the end. Next slide. We have a number of presenters, and they are all listed here and will be introducing themselves. So thank you for being here, everyone. Next slide. As an overview, we're going to be working today on how to understand why shared goals matter in the development of an ecosystem of care. We're going to explore data and community engagement strategies. We're going to learn tools for assessing needs and gaps. We're going to identify approaches and tools for co-creating measurable outcomes by, for, and with children, youth, families, and those who are supporting them. And we're going to learn from a spotlight county, Sacramento County, who's doing this work on the ground. We're also going to we're also going to hear from youth and young leaders who are participating in this work. And then we're going to have a Q&A. Next slide. The intended audience for all of these webinars and the implementation guide is everyone who is building systems by, for, and with children, youth, and families in the field and in California. Next slide. For the recap and introduction, just so everyone remembers that in our previous webinar, we went over realizing shared leadership, and these are all recorded. So you can watch that if you would like to do that. And today we're going to get into developing shared goals, centering youth and families, and then moving from that shared leadership to shared outcomes development. Next slide. Chapter 2 of the guide, which the implementation guide is on the Transforming Together website at San Bernardino County Office of Education. So the introduction in chapter 1, which we reviewed in the last webinar, as well as chapter 2 are up on that website if you want to see those. And then of course, you'll also have access to these webinar materials in the PowerPoint. So we're going to talk about using data and community engagement to assess needs and gaps, identify priorities, and measure progress. Next slide. We're going to talk first about the what. Next slide. The what is that we are working together towards an integrated system that enables us to understand not only the system, but the services and supports that are available to families and youth, co-creating with them an ecosystem that we all collectively own, and then identifying and celebrating our collective impact and the successes that we are realizing in the counties and communities in California, as well as California as a state. So moving from siloed services, initiatives, and efforts to really integrated efforts to build collective impact towards goals that we identify, measure, and celebrate. Next slide. We want to move from shared vision and leadership once we have established that, and we talked in the last webinar about the importance of that being our first step, to then identifying our clear shared priorities, concrete goals, and metrics for progress. We are much more successful when communities being served help co-create our priorities and our goals, and we're going to be talking about that today. Next slide. The challenge is cross-agency goal setting and cross-community goal setting. And we have a lot of goal setting already. Agencies already consult with community members, set goals, measure impact, and use data for accountability and improvement in various initiatives and in various efforts, but usually, almost always, separately. And the different approaches need to be used to identify community and population needs, which then results in redundancy and inefficiency. We aren't collectively united in gathering the information, and we aren't collectively united in measuring our impact. And that creates challenges both for those we are trying to serve and support, as well as the people who are trying to serve and support. So we are really moving to the next slide, which is an integration opportunity that we have right now. The ecosystem approach that we have now allows us to share priorities, share measurement, and have less duplication and an increased impact. So that is what we are shooting for. Next slide. The why and the how is really the integral question. I think everyone agrees that we are better together and better united, but the why and the how is the challenge. And so we can go to the next slide, and that's what we're going to talk about. Shared data inventories can be utilized and developed, and technology is evolving so quickly that it is much easier to do this work than when I personally started really discussing integrated systems for children 10 years ago. We need to really understand the macro data that's already accessible across all of the agency partners. And when we in the guide and in this webinar say macro data, we're talking about information about service utilization, service or population gaps, trends, overall outcomes, and data that is de-identified. I'm going to talk a minute about identified data sharing, which is equally important. Next slide. Macro data questions that we ask are, what data is already being collected about our population? What does the data suggest about needs, gaps, and goals when we look at it collectively? What patterns or new insights emerge? And what do community partners, children, youth, and families identify as need, gaps, and goals? What are their reflections on the information that we are gathering? Next slide. One way or ways of integrating qualitative and quantitative data, both of which are very important, is listening sessions, interviews, focus groups, and then the development of these shared data dashboards. And Sacramento is going to talk about their effort as well. Next slide. Community voice is critical. It is one of the most critical aspects of this, both in the development of your outcomes and metrics, as well as in your quality improvement and control and reciprocal accountability. Without it, we cannot effectively search and serve and support the families, youth, and children that we are trying to serve and search and support in California. So we need to use data that is informed by them to guide the process and recognize patterns of inequity, community assets, systemic barriers, policies or procedures that may have caused harm. We need to strengthen trust and ensure that future decisions are grounded in transparency and accountability. And today, Mariah and Saran, our young leaders, are going to talk about how to engage them and incorporate them into these processes in a meaningful way. Next slide. One of the things that we want to mention is when we talk about data sharing, we do really need to be thinking about macro data, de-identified information that we use at the system level to build shared goals, and micro data, personally identifiable data sharing that is in case files for young people. And we want to be able to share that micro data. We do not want them to have to tell their story 10 times to 10 different agencies that are serving them and supporting them. And we'd go into that more in chapter 4 of this guide. And I think that one of the things we want people to be mindful of is there are differences in the law when you are sharing information, whether de-identified macro information or identified case files. And you have to really be mindful of both and which aspect of this you're talking about when you're integrating your system and sharing information. We go into macro data in chapter 2 and micro data in chapter 4, and both are very important, but they are different. Next slide. One of the key components of the work is co-created outcomes. And so we really wanted to lean into what is in the guide around building co-created outcomes. Next slide. I'm going to turn it over to Mike to talk about this section. Thank you.
Thanks so much, Elizabeth, and hello, everybody. So glad to see you all here today. I'm assuming you're all somewhere in California, and right now it is a very beautiful day for you. I am going to be joined in a moment by Amanda Dickey, so I'll kick us off, then Amanda's going to talk about tools. One of the things I really want folks to understand is there's some historical and organizational barriers to sharing data, all of which can be overcome by building authentic trust, communication, and engagement. Because there's been historical mistrust and harm amongst our populations and with people who have had lived experience that might be joining your ILT or your system of care, ecosystem of care team. Also, there might be historical mistrust between organizations, where in the past, leaders may not have seen eye to eye or been part of an ILT. And I think this really just punctuates the importance of having strong integrated team leadership. Another area is kind of one-sided or tokenism or tokenistic engagement. Sadly, I think we do this often with family members and people with lived experience. They'll be invited to a singular event where we look for input around data or metrics, but not part of the decision making process or part of the leadership team. A big shout out to Yolo County, who I met with yesterday, who's including family and lived experience on their ILT, removing this tokenistic barrier. Structural and cultural barriers continue to exist, along with limited internal capacity and skills. Maybe this might be one of the number one areas that I run into as I'm working with counties. Michael, we don't have time for that. It's so hard to collect that data. But by working together, I think we can make that easier, especially if we're using the same metrics. And Amanda and I will talk about that. And then, of course, the power imbalances goes back to kind of the structural and cultural barriers or tokenistic engagement that I talked about. Next slides. So moving on, the co-created outcomes, I really want folks to look at how our agencies can align um, similar outcomes, but often we're in isolation. So you'll see the state requested outcomes from probation or child welfare or other agencies, and they're very similar to each other, but we're all doing it in isolation, causing duplication of effort or overlap in our work. And so part of addressing one of the barriers I just talked about is identifying those outcomes that are shared. I think a good example is the new BHSA, Behavioral Health Services Act requirements, really mirror data from child welfare as well as education and other agencies. So this can help advance our shared goals together if we look at that through the ecosystem of care. Next slide, please. So I want people to begin with looking at existing processes to expand the work that they're doing. And we are fantastic at collecting a lot of data in our state for mental health. There's external quality review. Community health has the CHIP-CHA plans that are happening in earnest right now. Local control accountability plans for school. Managed care plans have their data sets. I talked about BHSA and BHOATR, Behavioral Outcomes Accountability Transparency Reports. It's almost exhausting to talk about all the forms of data that each of our agencies or domains or silos are asked to collect. And Amanda's going to show us some strategies now for moving that forward collectively and making these things much, much easier than doing it on our own. So I'll turn it over to Amanda.
Thanks, Mike. Let's go to the next slide. Okay, so a quick kind of background framing. We're thrilled to partner with this group. We have been aligned and working in alignment for quite some time now. And we have created, very similar to the guide or in alignment with the guide, an ecosystem of care toolkit. I've done that in partnership with CCEE, who's an incredible partner. Obviously, they really focus on the education side of things, but they're very interested in the whole child approach. And so they've invested in the ecosystem of care toolkit. The toolkit is, again, aligned with the guide, but different in that it's very focused on the practical resources, templates, checklists, step-by-step guides that, again, are incorporated all throughout the guidance document that we're talking about today. So of those tools, one of the tools that we have provided is a chart of child and family serving agencies. One of the things I noticed, I sat on an AB 2083 work group for a few years in a particular county. And one of the things we certainly noticed in that conversation, as well as many other conversations that I had in shaping the guide, was essentially that while there are many folks within a county ecosystem, they're not all necessarily aware of what each other does and what their legal and fiscal responsibilities are. So, the Chart of Child and Family Serving Agencies is a really great resource to provide to an ecosystem of care group to kind of say, "Hey, take a look at this. Just get a sense of what's going on in your community, what people's responsibilities are, what they're likely doing." Again, it's very high and very generic. Many counties, many of the agencies listed on here do things that are far beyond what is listed on that sheet, but it's a good starting point to get a general sense of what's going on in the field. If we can go to the next slide. And this tool, so it's an existing needs assessment tools and data resources, is very much related to a lot of the comments that Elizabeth mentioned earlier. So this helps answer the question that she mentioned, which is what data is already being collected. Again, it's not completely comprehensive because it would have to be absolutely massive. And what we're trying to do is give you something practical that you don't have to spend hours searching through. But this chart essentially gives you, organized by various different topic and type of information, a few good resources that you can utilize, as well as a very short description of what those resources contain. So it is a handful of resources where you can identify education data, a handful of resources where you can find health data, and then there have been some requirements through various state legislation in the last few years to do needs assessments and asset mapping. So there's also a list of some of those places where you might be able to find an existing needs assessment or asset map in your community, and those are generally at a county level. Next slide, please. And then finally, to kind of take us back a little bit, we have a summary of interviews. So the way that we created the Ecosystem of Care Toolkit was through interviews with 30 plus different individuals who work in the field, the majority of whom actually sit on AB 2083 work groups, but most of whom actually sat on more than that. They sat on other integrated systems work groups or ecosystem work groups or a children's council or judicial council, et cetera. So this is a summary of the interviews that we had with them that informed the work that we put together in the toolkit and many of the resources that we compiled. And I'm going to hand it, I think, now back to Mike.
Amanda, could I interrupt? It looks like we have a hand up, and I'm not sure if we're waiting till the end or not. So I just wanted to jump in and see how we're handling that.
We were waiting to the end, Chris, on questions that people
Very
have,
good.
and they can
Okay.
chat it in the Q&A or otherwise. And also, Amanda, I think in the next slide, there may be another tool after your summary of interviews slide.
I'm not seeing one.
He just put it on the screen.
Oh, there we go. Okay. Yes. So the examples of community needs, goals, and metrics, that is something that was created, again, as an example based on the interviews that we did with the 31 different individuals in the counties. Again, based on real world examples of what came of various different conversations that these folks had in their interagency work groups. Or again, ecosystem of care work groups, where they identified a community need, the goals, and then the metrics that they were going to use to measure their progress towards meeting those goals. And now I hand it back to Mike. Thank you.
Thank you so much, Amanda. What a wonderful group of resources compiled by a lot of dedicated people to children and families. So moving on to the rest of chapter 3, I'll continue to talk about the benefits of co-created outcomes. And what I want folks to think about is coordinating your efforts and towards shared outcomes, how it demonstrates stronger impact and return on investment. I imagine a time when integrated leadership teams can measure both of these, stronger impact and return on investment, while they work together in their integrated team leadership team meetings monthly or even better twice a week. Next slide. it creates a unified story that's backed by shared data so that the leadership team for the county and even the state can look at how data is informing the story of our community. How is data talking about the current needs of children and youth and families in our community? What's the story we want to tell for improving those outcomes? And by working together on integrated data or co-created outcomes, we can achieve those goals. Next slide. Again, it creates less duplication and administrative burden. As I enter into this work, as I said before, one of the comments I get, I won't say complaints, but comments I get often is we're so buried by multiple data metrics. We can't keep our heads above the water line. And by taking a little bit of time to look at shared dashboards or aligned reporting, it really does lessen the administrative burden and pushes it out across multiple agencies by making it easier. Plus, we're focused on what our shared mission and values are that we've talked about in other chapters, and ends up using fewer resources. Next slide. So it also creates a clearer, more consistent communication with the community. So by this, I mean we're not having child welfare agencies or probation or education agencies working in siloed, putting out their outcome measures and what they see happening. It aligns us to work together, building more consistency, creating more transparent opportunity for updates, and engaging the community in a more authentic way. Next slide. So number 6 is having more meaningful engagement with youth and families. And again, I gave a big shout out to Yolo. Many other counties are including family members authentically in this process of developing shared outcomes, as well as youth and others. And as equally importantly, keeping and engaging with other agencies in a truly authentic participation process, working towards accountability and our relevant services across all our agencies. What are we rowing our boat towards? And by creating those outcomes that are aligned with our vision and mission as an integrated ecosystem of care, we're more able to get there. Next slide. So potential metrics we can use, mental health and emotional well-being tools and metrics, education and academic success, along with, other barriers, student attendance and school engagement, physical health metrics, safe at home and community. Are children living in our community or are they being removed and headed towards foster care? So monitoring those detention rates and foster penetration rates, youth engagement, social connectedness. And I think the economic and workforce opportunities is an area that's often missed as we work in an ecosystem of care. We're not thinking maybe past our traditional youth serving county agencies to the community and other agencies, as well as, we've done a big push to improve the workforce with wellness coaches. And so can certified wellness coaches create an opportunity to respond to some of the data that we're collecting? Improving cultural and identity development. Again, I talked about including folks from our community directly in the development of what metrics we're monitoring, as well as participating authentically on teams. And then, of course, last but not least, impact in our crime prevention and juvenile justice reduction, which we've seen magnificent improvements over the last 10 or 15 years, both in child welfare and juvenile justice or reduction of juvenile crime. But we have a little way to go, and by aligning by aligning our data together, we can more specifically address what concerns there are still out there. And so now I'm going to turn it over to Saran Tuckstruggle, and she's going to talk more about our next steps and chapter 3 and authentic community and family participation. And I have to give a shout out to Saran. She is one of the most extraordinary, passionate individuals I know towards raising authentic voice, both locally and nationally. So over to you, Saran.
Thank you so much, Michael. And hello, everyone. My name is Saran Tuckstruggle, and I formerly served as a student commissioner for the California Department of Education by Education and Special Education. And as a young person who has disabilities and been through the system, it's been kind of my passion to do this work. So the component I'm going over is authentic community and family participation. Going more about what the guideline says and talking more about the resources that you can bring to your communities and what does that look like. So can you go to the next slide? Okay, so the family engagement continuum. So the purpose of why we're doing this is that we want families to have a decision-making authority, not them to be a part of it, but more like leading those spaces, right? Because it is their system, they've been through a lot and they know a lot about their children's and then know about like what's happening in their communities and having that piece on that voice and sharing those perspectives, right? And the way that we are going to be able to do that is by the 5 progressive levels. And the 5 progressive levels look like from awareness, passive engagement. Number 2, consultation and input, the advisory role. Something that I've been doing for the past 3 years is my position to Advisory Commission on Special Education. The California Department of Education created this role for me to be part of this Advisory Commission on Special Education, but also share those inputs, right? So it's like a lot of statewide or agencies and like local agencies and things like that will open these advisory boards and these advisory roles so that youth put is in there. Partnerships and collaborations and active engagement. So making that like you're working with the families and the youth at those tables, making that you're engaging them in the work, right? And number 4 is shared leadership and decision making. So empowered involvement. You're not just having that young person there work once, but you're making them multiple times as continuous involvement. And number 5 is family driven systems, meaning that like as a system, you are changing the way that you think your perspectives and you're really actively engaging those young people at those tables, but also learning more about their experiences. How do you take those experiences and put it into those systems? So yeah, and this is a practical framework by the Family Engagement Continuum by conceptualized and defined by SAMHSA, the International Association for Public Participation, the IAP2. Next slide. Yeah, so now let's talk more about engagements must shift power, something that I care a lot about. And I think one of the progressions from this progression of this family engagement continuum main ideas from the last slide. This is from the Christine Ortiz-Guzman work on Equity X Design, which is a resource that emphasizes the process towards the outcomes and what power should be intentionally shifted towards those been impacted by the system. And acknowledging that, but also making sure that we implement a system that designs to shift that power, right? And the goal of this is that we're not just simply engaging families, but we're creating conditions and we're creating spaces for them to be as stewards of change, for them to be actually leading those changes. Often in my experiences, I feel like a lot of systems will create these type of things, but they end up don't include the young people's voices. And a lot of times that feels that way. So it's important that as you create these systems, as you create these advisory boards, or what are these you create these, making sure that you actively really engage those young people and those families and making sure that you create spaces for them, because often going to these spaces as a young individual, it's very uncomfortable, a lot of power imbalances, and it's a lot of like, what do I do? What do I say, right? And sometimes it can come as performative because a lot of times as spaces I've been, sometimes I feel like a lot of officials will be more performative or create the space more performative. I'm just like, no, it doesn't need to be performative. It's a way that like I don't want to be seen as literal or greater than, but I want to see seen as a human being, all the systems and all the lived experiences I've been through in a way. So really creating those spaces and things like that. But it's important to use these resources because often that these resources don't reach the people. So making sure that you bring all these resources from the state, because a lot of money is going to these resources, and making sure that resources are going to your school districts and your schools, because I feel like families and communities would really benefit from these. And yeah, the next slide. And the last final slide is like these 3 questions that I want all of you to take away from, and is how does this continue to accommodate collective Indigenous and other cultural approaches to decision making? How do community members hold systems accountable when they don't progress along the continuum? And what happens when systems cause an additional cause additional harm during engagement processes? So these are 3 questions to really look into and really like ask yourselves as an official or in part of the system. I feel like the first question for me is really important to me because a lot of my work is not looking at one group, but looking at all the groups in total, looking at all the different groups, because in California, we don't just serve one population, we serve so many different populations, right? And something that I like to did is when I was on the commission, on the Advisory Commission on Special Education, since they really created a nice community for me to like use my voice and actively be involved, but also look at the different systems, I'd always ask like, who asked for this? And like, how does this impact those in incarcerated systems, foster youth systems, homelessness systems, right? And how does that connect with this work? Because often I felt like when I was working in the systems and representing over 860,000 students with disabilities, I always felt like, well, this system doesn't just impact disabilities in education, but also it also impacts those incarcerated, because there are incarcerated youth with disabilities in California California Juvenile Justices who also have disabilities and also go through an education system too. So a lot of my work really focused on the different communities, and then a lot of it too is bringing in those Indigenous communities and people who work in those systems to come to speak at AXI and things like that, because I think that understanding from the different perspectives and the different communities is really, really important, especially you want to be creating a system where all those voices are included in a way and making sure that you hear from the different perspectives. And I think that we're not the best at this, but I think we're getting better and better at this as California continues to go in the next few years. And how do we communities hold systems accountable when they don't progress? I would say as a community member, but also as a youth advocate, what I do before is like ask the hard questions, always ask the hard questions. And also like finding a common ground between what you need to say and what others to say. Because I feel like right now in a country that's very polarized, it's important that you really ask those hard questions, but also making sure that you create those spaces. And I think that systems need to create those spaces for young people and families to come together and actually talk about it, like talk about one-on-one, like what are the issues and how do we progress together, and where do I play in or where do you play in, things like that. Because I feel like building that trust is really important in this crucial time, especially how polarized everything is, but really asking those hard questions as family members and students, because a lot of it is at stake, and you want to make sure that you keep your eye out on things like that, and funding, and how do you advocate for students and things like that. How do I make sure that this student gets their needs and things like that? What happens when systems cause additional harm? I feel like when they cause additional harm, for me, I feel like a lot of damage just come. A lot of young people feel like they've been cheated by the system. Often I feel that way too. Later, Mariah is going to talk more about payment and why that's very important for young people and families who are doing this work, because I feel like a lot of young people are not getting properly paid. It's a lot of work, it's a lot of effort, and a lot of us are being vulnerable and putting our time out there. So yeah, but I think that it can happen in many ways, and I feel like it's important that you have that communication piece and talk to each other and building that trust and before, so you don't have those additional harms. But yeah. Thank you so much, and I'll be passing off to the next speaker, which is, yes.
Mariah,
yes.
Hi. I'm Mariah. I am a youth fellow with CYPHI, and I'm going to be talking about like realistic engagements expectations. I want something important is to know is that engagement is not a one size fit all. There are some like youth and community members that want to be deeply involved in the system levels, decision making. They want to sit at the table, they want to influence policies, and they want their voice shaping programs. But for others, that type of involvement is not something that they want. They probably prefer like user-friendly systems that allow them to navigate services easily or have control over their lives without needing to engage on such a deeper level. And I feel like both of those engagements are valid. Our role is not to enforce one type of engagement, but to build an ecosystem that works for everyone, regardless of how they choose to engage. And that means just creating options for people, being flexible and recognizing that engagement can look different depending on like someone's capacity or what they actually need in that moment. Next slide, and I'm gonna pass this slide to Amanda.
Thanks, Mariah. I love what you mentioned there because you're absolutely right. Engagement should look different based on capacity and based on interest. One of the in the ecosystem of care toolkit that we've created, again, we have a lot of resources, including there's a tip box on various different models for engaging youth and families as well as on the ground providers. I will just mention very quickly one of the I thought really valuable anecdotes that is mentioned, I believe, in the summary of interviews came from someone who mentioned that the youth, the family member, and the provider, they are the canary in the coal mine. I thought that was a really good example, essentially saying they're the ones who are going to tell you that something is going wrong, that there's something maybe happening in your community. Perhaps it's an increase in use of opioids. Perhaps it is a breakdown of family structures, whatever it might be. You're going to hear that first from your youth, your family, and your providers, which is why it's so essential to engage them. In addition to those tools, we also have some examples of integrated systems activities, which is here, and Megan just dropped it into the chat. Again, these are all anecdotes that came from our interviews with the 31 folks that we met with in the field who serve on various different work groups. And what I think is important to kind of take away from that is there's a lot of kind of misperceptions of what is collaboration between various different agencies. And this gives you a really good example that collaboration can look, just like engagement, can look very different in a lot of different ways. It can look like co-creation of locations. It can look like assigning staff to various different locations. We had some really interesting stories from folks where they talked about various staff members from, certain agencies being assigned over to the public health agency during COVID so that they could create kind of seamless integration and seamless services, and communication could be aligned, because if you recall back in 2020, it felt like the guidance was changing constantly with regards to COVID and keeping folks safe and, masking or not masking, 6 feet, all of these things. So some really good examples are in there to kind of broaden people's perspectives of what integrated systems activities can look like. It's not just data sharing. It's not just financial, sharing of finances. It can include that, but it also can include many other things like utilizing various different agencies to disseminate resources, to one of the great examples, and I know this can be really hard to do, but it was sending folks from the behavioral health department, the public health department, the social services department to back to school nights. And that's not something that's utilized in many places, but it is an incredibly valuable tool for, again, just kind of bringing agencies into spaces where families and youth are already present and meeting folks where they are. If we can go to the next slide. And so one more tool we'll just highlight today is activities to establish shared understandings. Again, this is all based on the interviews that we did with various different folks in the field. And we asked, one of the core questions we asked folks was, what activities or what did you do to try to help understand each other's roles and responsibilities better, and to help identify the overlap in both the data that you're providing, but also the communities that you're serving. There's so much overlap. If you talk to families, if you talk to folks in the field who are receiving services, there's so much overlap. They probably have a contact at social services and probably a contact over at the housing department and a contact over at the school. In fact, they probably have two contacts over at the school. Maybe it's their assistant principal, but also their foster youth coordinator. So this is an example, or multiple different examples of ways in which in an ecosystem of care meeting or work group, you can engage in various different activities to try to increase the group's understanding of each other's roles and responsibilities. And I think I'm going to hand it now back over to Mariah.
Yes, so this is about why compensation matters. So when we talk about participation, compensation is really about equity and access. So without compensations, I feel like we're like unintentionally excluding youth and families who are balancing work, financial stress, or like childcare. And I feel like compensation helps remove those barriers, whether they're covering transportation or childcare or even lost wages. More people can actually show up and participate. I feel like it also improves like representation. So when we compensate people, we're able to include voices are that are the most impacted by systems, because like not just the people that like have time or like even the privilege to participate for free. And I feel like that leads to a better quality of participation. People are able to stay engaged longer and prepare and even just build stronger relationships with organizations when their time and contributions are valued. For example, like the CSBHI, before joining, I did not have a baby, but they were compensating me, and even still, even after having a baby, I still felt very supported, and like they just made sure I was able to show up even with the child, even when I didn't have childcare, and like help me out at events with them, just being at my baby, and they were just very supportive and allowed me to show up even a lot more. Next slide. Compensation is also about power sharing. So when we value lived experiences alongside with professional expertise, I feel like we start to shift the traditional power dynamics and build real trust with communities. It just sends a message that like lived experience is expertise and not just a story to be shared, but it's like insight that's to be respected and paid for. At the same time, we know that like agencies have real budget constraints, so this is where sustainability comes in. Just thinking creatively about funding and building compensations into budgets from the beginning, and prioritizing equity so that compensation isn't just an afterthought, but a part of how programs are designed. Next slide. And these are some resources for people who are thinking how to like implement these. So the engaging community members is a strong framework of how to structure compensation in a way that's fair and consistent. The Parent Compensation Tools website offers tools and examples that like organizations can use to build their own models. And evaluating incentive strategies on parental engagement helps show like the real impact that compensation can have on participation and outcomes. So there's already tools out there. We just have to be intentional about using them and like prioritizing them. And I'll pass it on.
Hi. It's back to me. So I'm just going to talk about some overarching strategies that we should be thinking about in doing the work. And I just want to highlight, you probably are already noticing that in the implementation guide, we have the why, the what, and the how. And in the how, we have resources, we have tools that we have pulled from all over the state with relation to people who are actually doing the work. And these are some of the tools that Amanda is talking about, as well as the tools that you just saw regarding compensation for participation in the feedback that we got in building the guide, which was built through a really collaborative effort. People wanted to have examples of both the people who are doing the work as well as how they did the work. So we've tried to incorporate as much of that as possible into the guide. When we look at strategies, some of the you can go to the next slide. Some of the overarching challenges that people have reported and we want to recognize is that obstacles and setbacks are inevitable. We need to have patience with this work and we need to give each other the grace to do the work as well as incentivize the work. Leaders should revisit existing processes and explore alternatives within the broader ecosystem to building a more effective, efficient ecosystem by, for, and with our children and families and those who serve and support them. Cross-agency collaboration, when you start to do it, can reveal new approaches and shared solutions that we really have never imagined before. And I would say that this is true in California and probably beyond, although I only ever work in California. It brings shared solutions that we can implement together so that we have even more increased collective impact. One of the examples is counties incorporating focus group research from their first 5 commission into their child welfare comprehensive prevention plans. And we've also seen both of these bodies of work being implemented into the work in education, in building a whole child system, and in identifying 21st century learning objectives for the portrait of a learner so that we can really ensure that we're maximizing utilization of our human and fiscal capital and resources and enabling our young people to achieve the outcomes they want for themselves and we want for them. Next slide. Using imperfect but reliable data, we got feedback that people were nervous about really diving into shared data and shared data analysis. And one of the reflections that we've heard from the field is that many of the data sources can serve as stable proxies for decision making, and good data can guide coordinated action. For example, school absenteeism data reveals meaningful trends for early intervention, but where we really get the power is when we start to share our data and information in order to collectively analyze what it's telling us and incorporate our children, youth, and families into those discussions. And that is really some of the powerful work we're going to hear about soon here. Next slide. Key principles for success. One of the really important things about this work in California, because it is ecosystem building is happening at all levels in California now. It's happening in our aftercare service delivery systems for children, meaning after school. It's happening in our early care service delivery systems. It's happening in our system of care work. It's happening in our community schools work. It's happening in the Child and Youth Behavioral Health Initiative work, and many, many other bodies of work are incentivizing us to integrate into a more united ecosystem for children, youth, and families. We want to be able to inform the state and state authorities about the coordinated approaches that you are furthering in the field so that we can identify models, elevate models, and make this the work of California. We want to ensure regular reporting at the local level from your work groups to your interagency leadership team, whatever that leadership team is at your regional or county level. And you want to document your agreements in shared policy and embed them in your AB 2083 System of Care MOU or other interagency operating agreement in your local work so that you have that codified and you have your regular reporting happening both at the local level and then to the state. Next slide. Key principles for success. We want to be sure that family and youth are co-designers of a new ecosystem of care. This is where we are headed. This is what we will realize, I have no doubt, in the state of California. And I'm just so excited to see everyone presenting here, as well as turning it over right now to Sacramento County to talk about the work that they've been doing on identifying shared goals and what that has looked like. So I'm going to turn it over to Sacramento. Thanks so much. Next slide.
Hello. Hi. We're from Sacramento County. We're going to be talking about our work in Sacramento County. So next slide, please. So go ahead, Julie.
Hi, everyone. Good afternoon. Still morning. I'm Julie Galello, and I'm the Executive Director of our First Five here in Sacramento. I'll hand it over to Tabitha.
Who I think is signing on right about now. So I'll just go ahead and
turn it back to Daphna.
Yeah, hi. My name is Daphna. I'm with Applied Survey Research. I'm a project manager. We were the evaluation partners for the AB 2083 system of care work. And so that's what we are going to be talking about today. And Tabitha, just to sort of introduce her, because I don't think she's on yet. She is with the Sacramento County Office of Education, the Executive Director of School-Based Mental Health and Wellness. Next slide.
So this is our joint vision statement for all three of our major child abuse prevention initiatives in Sacramento. We have an initiative under our Family First Prevention Services. We have a child abuse prevention cabinet and our AB 2083 system of care. And as you can see from our vision statement, it stresses safety, health, and thriving, which we are able to tell the story about that through joint decision making on our shared measures. Next slide. Great. So there's kind of a lot going on in this slide, but this is about our partnerships. So all of these partners on the furthest left-hand side are involved in our prevention work. They all have a role to play, some bigger than others. But what I want to stress about this is that as we make our way over, we're all super connected to the three measures in some way. And those are the three measures that the whole group jointly determined were going to be what we focus on and tell the story of through our work in the ecosystem. Next slide.
Okay. Thank you, Julie. Yes, so just kind of following from that previous slide, right, you saw that we had each partner has a role to play in the ecosystem of care. And critical to sort of figuring out what that role is or how to measure what that role is or what it looks like is about defining shared measures. And the way we do that, to kind of unpack how we did that, we're using the RBA framework, so results-based accountability, where we're talking about community results, indicators, and program data measures. And really what we did when we started working with AB 2083 partners was you really start from the community result, right? So what is the community result, the quality of life condition that you want to achieve in your community? So as Julie was just saying, we have children, youth, and families are safe, healthy, and able to thrive. And so safe, healthy, able to thrive, those are really the anchors around which we sort of built this whole system of care, our data dashboard. And you'll see in just a second. So then from there, we worked on indicators, population indicators. So what data can we use to measure the progress in our community for that community results? And then from there, that's where we went to the programs themselves and talked about, well, what measures are you looking at in your program that are contributing to and making changes to the indicator itself, the community result? And the neat thing about having a system of care, as I'm sure you all know, is that it's not really even about, right, what activities that I'm doing are influencing the outcomes I'm trying to achieve in my own system, but what could influence outcomes in our partner systems. And so that was a really key point when we were talking to our agencies about having them think about some of that. Next slide. So having them think about sort of their role in the system of care and what measures they would use, et cetera. this is the process really that we used to do this, and just kind of the practical sort of nuts and bolts piece of it really. So the first step really was having the agencies themselves identify relevant personnel for data discussion, right? So the people that you want at the table in these discussions are the people who can tell you what data are there, what data are available, what data you can collect, to make sure that it's just a practical thing, that you're sure you can actually have the information that you want to measure. And so then what we did was we met with each agency, we helped them identify measures and indicators, asked them questions about what do you have, what do you want to know, what can reasonably measure that, right? And then the agencies would reflect on that, they would go back to their teams, and they would come back to us, and then we would sort of repeat the cycle, right? So it's sort of this iterative process of refining and reselecting sometimes the relevant measures, right? And it's really paying attention to different people's thoughts about what is relevant, what's most important. And so allowing space for this, it's not a linear process at all, right? It's completely iterative. And then from there, you, in theory, are able to then consider the measures and indicators within the broader system of care. So the measures and indicators that you selected, how are they situated within the broader system of care? And that contributes to the conversations that you'll have more broadly in terms of AB 2083 and the ecosystem in general. So next slide, please. So then critical to these conversations about what data do you have, what can we collect, what can't we collect, and this idea of having, of really focusing on the system of care aspect, we chose Clear Impact Scorecard to display our data. So we really had to think about how are we going to be able to not just kind of talk about the system of care and the data related to it, but how are we going to be able to kind of look at each other's work and see what other people are doing and how we're all contributing to the community indicators and the community results. So we chose Clear Impact Scorecard as our way to display that information. And Clear Impact Scorecard is a shared platform. You can track aggregate data within and across the AB 2083 system of care partners. And this allows for transparency and collaboration. And it also enables real-time data entry and visualization trend analysis of results at population and program levels. And I'll show you what that looks like in just a second. And it also supports strategic data-driven decision-making and continuous improvement. Again, because everything is sort of displayed on the scorecard for everyone to see, everyone can have the same conversations about the same data points that you're all looking at. And it also functions as a monitoring and diagnostic tool to identify opportunities and issues. So really the key with, like I said, with the scorecard itself is the way it lets you look at data and work with the data and really have conversations around the data because you're all looking at sort of the same place and you know what each other are referring to. So next slide. And key to making sure that the data all makes sense and that we can all kind of talk about the same thing and know what our goals are and what we're headed towards really is the architecture of the scorecard. So figuring out how to organize the data in the scorecard. And the way we decided to do it is having separate result area scorecards and partner scorecards. And so you'll see up there what Julie was talking about, right? We have all children are healthy, all children are safe, all children are thriving. And then those are the bigger system area, result area scorecards. And then underneath that, you see we have every program in the system having their own scorecard. So each partner has its own scorecard with their own performance measures and system population indicators that they're reporting on. And the result area is its own scorecard, which is populated with contributing data from the program scorecards. And to show you what that looks like, next slide, please. So this is an example of one of our result area scorecards, just a screenshot from that. And so as you can see, this is all children are healthy. And so at the top there, we have the results section, which a scorecard calls them containers. So you might hear me slip into that every once in a while. So the result container, right, is all children are healthy. And beneath that, we have the indicators that are contributing to that result. And beneath that, you'll see that every partner that is contributing to that overall result, we have their program measures there as well. So next slide, I think it should show you that it's scrolling. So this is just many of our partners are are on the scorecard. And critically, not every partner contributes to every result area. So not all of the partners are showing up on this All Children Are Healthy scorecard, for example. But the partners that do have measures that are contributing to that do show up here. So again, this is just one area where we can all look at everything all in one place. And you'll also notice on the right, you'll see that we have information there like the most recent period for which data was collected, the current value of where the current data value, and the current trend, which looks at basically from the most recent period where data was reported, whether the outcomes are good or bad, or whether the trend is good or bad, considering, right? So you can set whether you want an increase to be good or a decrease to be good. So you could see the red arrows mean it's not really trending in the direction we want, and the green arrows mean that it is trending in the direction we want. And then we have baseline change, which compares it to the very first data point that you have in there. And you can also adjust that within scorecard, but I won't bore you with that right now. Next slide, please. And again, just more information about more examples of more measures from programs. Next slide. And here is an example of a partner scorecard. So this is DCFAS. And as you can see here, right, we have the result container there as well. And we have here the indicators that DCFAS is responsible for reporting on, right? It's not a program measure for them. It's just the result that they are responsible, the indicators that they are responsible for reporting on. And then underneath all that, we have their program measures separated by the result area that those program measures fall into or what they're contributing to. So next slide, please. I think you'll see that it scrolls again. Right. And so here, for example, we have All Children Are Healthy and the DCFAS program measures that go under that. All Children Are Thriving, the DCFAS program measures that go under that. And as you can imagine, on the result area scorecard that is All Children Are Healthy, it has those DCFAS program measures. And on the result area scorecard that has All Children Are Thriving, we have those DCFAS program measures as well. There's also the option, you can open up the reason we like this is you can click on any measure or indicator and it'll show you the trend right there. You can also talk a little bit about the story behind the curve or any other information you want to put on there so everybody has a shared context. And one thing I want to say is one of the things that we learned from doing this is that data fear is very, very real. So we realized that a big part of this actually was sort of trying to remove some of that fear from the partners, to letting them know, we're not trying to judge you. This isn't a judgment check. This is really just a progress check and to get information. So that was several conversations we had to have because people were, and I think somebody mentioned this earlier, people were hesitant, right, to put in their data, to talk about their data because they were worried that it was some sort of judgment. And we really had to say, no, this isn't judgment. This is just information. And without that, we don't know how to move forward or what adjustments to make. So that was one of the key things that we learned. And that is a nice segue to our next slide where we talk about more lessons learned. So go ahead, Julie, and next slide, please. Oh, I think you're muted.
Seeing it on in Clear Impact has made such a huge difference too. Like, talk about the fear. I remember sitting down in the early meetings and like sitting around my table, and it was just like spreadsheets and spreadsheets of data we were collecting. And it was so overwhelming. And to be able to use that system to make it so accessible, to see it in one place and makes it all that work worthwhile. So as far as our lessons learned goes, we chose indicators that are currently available, and this, I cannot state how important this is. We didn't want to impose new tools or new data collection processes for all the partners. And even though we knew like recommendations would probably come out of the work, we recognize that when you're getting started, it's just best to identify what you're already using in your system and go with it. And then we could make tweaks along the way if we saw something that was missing that we wanted to add, which we very rarely did. Set clear, focused measures. So everyone within their own agency is really, well versed at collecting our own data. We can pat ourselves on the back when we see our data is showing that we've made these amazing contributions. But then when you think about using your data for the good of the whole system, we kind of had to like put our egos aside a little bit, because some of the data that we were sharing was not always flattering. Like when you see the red arrows going in the wrong direction, that's just a little bit of a reality check. And if you're the agency who's funded to do that work, it could be a little stressful to put that out there. Expect to revisit the measures. So yeah, when definitely funding and policy often shapes what we do and how we measure our impact. As a result, like we revisit our measures often to make sure that they're still relevant. And if anything happens to availability, we'll see if something new came up that was more available or more ready for us to use. And also whenever we experience turnover, which does happen, we get new leadership, and sometimes new leadership has new ideas about the data that they want to include as well. So we keep a really open mind, and we revisit our measures and our data often. And then regular scheduled meetings, of course. Our team used to meet quarterly, and we're now moving to a semi-annual review sessions. And we ask ourselves to like acknowledge our successes, but also to explore our areas where we have gaps in our data or the negative kind of outcomes. So next slide. Great, and I think this is Tabitha.
Yep, I think you're muted, Tabitha.
Good morning. Happy St. Patty's Day for those of us in green. I am Tabitha Thompson, the newish executive director for our Sacramento County Office of Education's school-based mental health and wellness program. And so excited to be here today to present alongside some colleagues. I wanted to just underscore a couple of things that Julie just mentioned, especially as it relates to data fear. And so thinking about the team that you're working with, there'll be some folks that are very comfortable with data and then others that are very fearful. So really thinking about how to incorporate the use of data as a way in which we measure ourselves, and that we're able to look at the data and then move from there to things that may need to be changed or done differently, and not a scale of measurement that ends up being a negative situation. So for our program, we are constantly looking at data. Our program is one in which we have a mission to have a SCOE-based clinician at every single school site in Sacramento County. And so as part of our vision, we are always connected with our community partners who support us in many different ways, including the use of the scorecard. So for us, we are constantly looking at policies, constantly looking at the way in which we collect data. And so some of our policies that are working against us are that we are connected to LEAs, and they have their own rules and regulations as it relates to data sharing. And so we've had to have some of those conversations around how do we share data in a meaningful and productive way? And how do we make sure that MOUs speak to that so that we're able to collect information related to our students so that we can do some predictions in terms of penetration rates and encounters with clinicians and those sorts of things. So definitely continuing to have conversations with our partners, including our LEAs, around some of their policies, because we know that we are working with very sensitive information as it relates to our clients. And so want to just make sure that we're always working together with some of those policies. And then in terms of partners that have played a role in kind of turning the curve, if you will, we are always looking for folks that can help support some of the mental health work that we're doing at our school sites. And so for us, we are very connected to our county partners. We're very connected to our district partners. And then we're moving into this direction of trying to be much more aligned with our community-based organizations that are also doing some of the same or similar work. So I will stop there. Daphne, was there anything else that I did not touch on that you
No,
want
but
me to touch?
No, I think that was perfect. I think, Julie, unless there's something else that you want to kind of tap in that maybe Tabitha didn't chime in on, this is really, yeah, you all have the experience with that as well. So I think,
It's me.
yeah, thank you.
Thank you so much for presenting that and showing us concretely how you're doing this work in Sacramento. So important. And we're now going to move to audience participation and questions. And you can input any of your questions in the Q&A if you want to. And we also noticed that we have a young, well, I don't know yet. We have a MSW student that's doing a research project and has asked some questions actually about this collaborative and its development and how we've approached the work. And we've actually emailed separately so that we can have a follow-up conversation about transforming together and how this has evolved and all of the work of the pilot counties and others. So we look forward to having that conversation with you for sure. That's super exciting. And congratulations on your work. Some of the questions that we had for people to just leave with are, what shared goals and reporting already exist? You could go to the next slide, sorry, to the reflection questions. The next slide. What shared goals already exist locally in your agencies and communities? What data can easily be aligned today? Who needs to be part of your goal setting? And what are your biggest next steps as takeaway considerations for the work? But some of you may be doing this work in the field already. There are a number of counties and communities that are, of course. And so really what we wanted to focus on in these last 15 minutes is if anyone has any questions about any of the information that was presented by any of the presenters, and maybe all of us, it's quite a crowd, can come off of on the camera, off camera, so that if there are questions, we can be available to answer those questions, whether it's about youth participation or data development or whatnot. So we'll just see if there's any additional questions in the Q&A that are coming up for folks.
Elizabeth, we have had a hand up for a good portion of the
good.
webinar. Chris Mercado. I don't.
Great.
So I'll maybe we just see if Chris has a question.
Yeah, I don't think I see one in the.
I think their hand went down, so it could just have been an error.
Okay. I think if there aren't any questions, then we will close the webinar and thank you all for being here. So as I'm closing out here, if you have a question, type it in, and if not, we will leave you with all of these resources and thank everybody who was here. We have people here who are building tools in order to support this work. The state has been an amazing supporter of the development of all of this. There is a collaborative of at least 100 people and maybe more have given input into this guide and its development. And then also just thanks to the counties that are doing the work. We've referenced many of them in the guide. And of course, in every single webinar, we will be bringing in at least one county as a spotlight county. And to answer someone's question, where there'll be some of the rural counties represented, yes, there will be some of the rural counties represented in our webinars too. So just thanks for showing up. And if you have follow-up questions, feel free to email any one of us. You can go to the next slide. All of our presenters are here and all of our contact information is here. So feel free to contact us. And then the next slide, our next webinar, which is chapter 3 of the guide, moves from shared leadership and shared goal development to creating a universal service and support array in our local counties and communities, as well as coordinating that with workforce development and expansion of our workforce to help build the most robust universal array of services and supports that we can by, for, and with our children, youth, their families, and those who are serving and supporting them. So next slide. Thank you for being here and ecosystem building with us. We're excited about the work. There are so many aspects of this work happening in the state, and we're just trying to unite all of them. We hope you have a great afternoon. I think we'll sign off with that. Thanks so much. Bye.